So thank you so much. Happy Sabbath. Good afternoon. Thank you for coming, and thank you, Sam and Morris. Where is he? Thank you so much for introducing me to Sam, because he's the one who started the ball rolling on this. Within 2 minutes of meeting Sam, I was already asked to do this presentation. I feel really privileged and honored. So here's a little bit about myself. I myself am a graduate of Loma Linda, class of 2013, along with Dr. Rachel, and we both met in dental school, and we now have a wonderful little 3-year-old daughter, and that is what actually brought us to this church, because we were looking for a wonderful and awesome environment for her to grow up in, and we're so blessed to have found this church and this church family. And it's a privilege for us to give back and share to each of you what we learn and we know. And that's why we've titled our little presentation here, Healthier Smile, Healthier You. So to start, just a little overview is I'll be going over like the common oral diseases that we have, and then the relationship between the oral diseases and the common systemic diseases, and the most prevalent systemic diseases that we as Americans and even as in the world face, and how they're related to each other. And we want to also not just tell you all these scary things that are related with our mouths and our oral health, but also how we can improve it on a daily basis with our own health, home hygiene and practices and stuff like that. And of course, we'll have a little question and answer session at the end. So to start, there's two main, you could say, categories of dental disease, like the chronic dental diseases. Of course, there's a lot more, like oral cancers and stuff like that, but the most prevalent would be dental caries, which in the dental world is the chronic disease that causes the cavities that that the common person refers the dental decay to. The second one is periodontal disease, and this is broken up into two different subcategories, and it's the inflammatory diseases of the gums. For the first category, and the more, you could say, early stages of periodontal disease, is called gingivitis, and that is when the gums become inflamed due to the plaque buildup and bacterial buildup along the gum line and everything. That causes the gums to swell and then become sensitive, and then when we brush, we bleed. The more advanced stage of periodontal disease would be the periodontitis, and there's several stages of it. And each stage determines like how much bone loss we actually experience, or the patient or you yourself have due to the disease. Oh, sorry. Okay, so just an overview, we're going to be I'm going to be going over the relationship between oral diseases and diabetes, cardiovascular disease, and the subcategories of atherosclerosis, bacterial endocarditis, infective endocarditis, which is just an infection of the heart tissue and other body parts of the body due to migration of bacteria from our mouth and other parts of the body into the bloodstream, and also how it affects blood pressure. And then in recent studies, it has also been found that oral bacteria and oral diseases have been linked to causing strokes, transient ischemic attacks, and even Alzheimer's and dementia, and then also pulmonary disease. So diabetes, as we all know it, is a disease of sugar control or glycemic control the control of the glucose or sugars in our blood. For type 1 diabetes, it's affected by the amount of insulin produced, and then for type 2, it's how the body reacts and is inhibited, or I guess insulin resistant. Now, recent studies have found that diabetes is and oral health is a bidirectional, or it affects each other basically, in the sense that diabetes affects the periodontal health, and periodontal health negatively impacts the body's health, and it's like a vicious cycle that keeps, one affects the other, makes the other worse, and it just keeps going back and forth. Studies have found that patients that have uncontrolled diabetes are 3 times more likely to have periodontal disease and severe periodontal disease versus patients who have their diabetes under control. They're at very low risk of periodontal disease. The prolonged hyperglycemia due to poor diabetic control also causes, glycation, which is like the glucose molecules binding to protein molecules in their bloodstream, and these causes the body to release proteins into the bloodstream, which causes localized inflammation. And this localized inflammation is the inflammation in the gums, in our gum tissues, which causes the periodontal disease. And the localized inflammation over a long period of time causes the gums to pull away from the teeth and the bone, and then as this pulls away, more bacteria gets deeper in, and we get bone loss. And with the localized inflammation, it has a negative impact on the body's ability to fight infections, so the chances for infections also increases. So how, there's several, subsets of cardiovascular disease or aspects of cardiovascular disease that oral health and oral diseases affects. The first is atherosclerosis, okay, which is the pathologic narrowing of the arteries due to buildup of plaques and narrowing of arteries due to cholesterol and other cholesterol products, okay. It's been found through studies that chronic gingival inflammation causes the body to respond by releasing inflammatory proteins into the bloodstream, and these, when coupled with bacteria from our mouth that get into our bodies, into our bloodstream, causes the body to build up these plaques that block the arteries. In recent studies, there was a study in which they took the plaques from patients that underwent surgery to clear up the blood vessels and from patients that had passed away, and they studied the plaque to see what kind of microorganisms and bacteria were in it, and they found the presence of, I believe 7 out of 10 of the patients, they found bacteria that's responsible for caries, cavities, and periodontal disease in those plaques in the arteries. So it's pretty, convincing to see that these bacteria that's in our mouth does travel to other parts of our body and does cause different systemic diseases like atherosclerosis. Okay, and the periodontal diseases and the caries in our mouth also migrates, can migrate into the heart tissue and brain tissue. Anecdotally, I recently had a patient that's, most patients, when I see them, and I tell them, I'm sorry, the tooth is beyond saving, we have to take it out for you. And this particular patient I've been telling him that he needs to take out his teeth for about a year and a half now, and he's been putting it off and saying, it doesn't hurt, it doesn't hurt. I'd rather just keep it in. I want my teeth, I want to be able to eat. And I just have to, and I've been trying to encourage him to take it out so that he won't get an infection that migrates somewhere. And unfortunately, and I guess fortunately, earlier this year, he was hospitalized and for 3 months on IV antibiotics because unfortunately the bacteria from the periodontal disease that he was suffering from did migrate to the heart, and he was hospitalized for 3 months. And I say fortunately because he was able to be healed, and he was able to recuperate and recover, and he was fine. And ironically enough, when he came to see me, his cardiologist had a note that said, please take out these teeth. And the first thing he asked me is like, is there any way I can save these? And I told him, I'm sorry, I really don't suggest you do that because you were just hospitalized for 3 months and you're on IV antibiotics and, so but fortunately he finally relented and he got his teeth taken out, and yeah, we're in the process of making some dentures for him right now, and he's doing well and healthy, so it's great. Another aspect of cardiovascular disease is hypertension. Increase buildup of plaque in the arteries and walls. it causes the blood pressure on our heart to try to beat, push with more pressure to get the blood through our vessels, and it increases our blood pressure as well. Okay. Yes?
If the antibiotics will cure the infection in the heart,
Mm-hmm.
would it also cure the infection in the gums?
Unfortunately, it doesn't, because what the antibiotics does, it just helps manage it and to bring it to a healthy level. And for the heart, I guess I would have to defer to an MD to see if that actually, it does kill off the bacteria, but in the periodontal, in the mouth and the gums, because it's a chronic condition, so the bacteria is trapped there, and it's been shown that, antibiotics actually don't really work that well in the gums, in the deep pockets. There are some antibiotics that target it and work a little bit better, but ultimately, it's the only way is to get rid of the teeth and get rid of the source of the infection for the bacteria to get out, for the body to heal and for the bacteria to be removed and eliminated. Yeah. A lot of patients I have and that we have, they ask because, I need a root canal because the doctor says I have an abscess at the root or tip of my tooth, and can I just take antibiotics for it? Because I take antibiotics and I feel fine. Makes me feel better. But the thing is, because there's no avenue for us to remove the bacteria that's trapped there, it only controls it and manages to a manageable level where you're not feeling pain. But eventually those bacteria does come back. So usually it's like for dental infections and stuff like that, for that require a root canal, the antibiotics don't really work that well either. Mm-hmm. Yeah. Anything? Okay. So in regards to stroke and transemic attacks and Alzheimer's and dementia, I categorize all these as effects on the brain and on the cerebrovascular structures. There have been cases of bacteremia or dental bacteremia, which is dental bacteria from our mouth, oral bacteria from our mouth, and periodontal bacteria traveling and migrating, as I mentioned, to the heart and also to the brain. I myself personally have a couple friends who lost relatives, and I'm sure we've all heard the rare occasion of like in the news or something, or maybe one of us here has, personally had a loss where someone didn't take care of their dental infection, and they had no clue it was there, and they just passed away for no reason. And then when they did the autopsy, it was, it's because they had a dental infection that migrated to the brain or other parts of the body. So that's why, as dental health care providers, we encourage our patients and we encourage people that, friends and family and people we meet that it's important to go get a checkup, even though you don't feel any pain or you're not feeling anything that feels off, because unlike the rest of our body where if you get a cut, you feel that pain immediately, all the vital structures in our teeth and in our mouth is encased in a hard enamel and like a thick armored layering, you could say, and it's covered by bone and everything. So by the time any infection or a cavity gets to the point where it's causing you pain, it's actually already in a really severe state. In the dental bacteremia, there are certain groups that, in the streptococci and viridians groups, that cause platelets aggregation, which is blood clots to form, and then the migration of these blood clots to the brain results in a stroke or transient ischemic attack. Now, the Porphyromonas gingivalis, the P. gingivalis, that's the primary bacteria that's responsible for periodontal disease. Some recent studies of about 53 patients have found that patients with dementia have this bacteria migrating to the brain, and when it's in the brain, it releases this enzyme called gingipane, which then destroys the nerve tissues and nerve cells around it, resulting in memory loss. And I didn't really read through the full study because it was a really long study, but from what I read, they took the studies that they checked on, the samples that they took, they found that with the larger loads or the, I guess, more progressive or larger amounts of P. gingivalis and gingipain in the brain, the more severe the case of dementia, and then they're guesstimating, I guess, or hypothesizing that once a certain load has been met or once a certain threshold has been met, that's when dementia and Alzheimer's sets in.
Did they find any other causes in there?
What do you mean?
Well, besides that gingivaline,
Um,
find other things that were in the brain?
oh. For the study itself, they were just focused on looking for and finding if periodontal pathogens and oral bacteria have any relationship with the dementia and Alzheimer's. So I think they didn't really focus on any other possible causes, but just were looking for a relationship or a presence of the bacteria. And and since they found it, they were saying, okay, they would check to see what it caused, and they noticed that these bacteria, release the gingipain and then results in nerve damage and then eventually dementia once a certain threshold was reached. Mm-hmm.
So those are people that have some kind of dental problem.
Yeah.
And then they found out.
Mm-hmm. Yeah. Yeah, and unfortunately, these were people that passed away. The only way to get the samples, Yeah, but they looked at patients that had dementia, and then they also looked at patients that had periodontal disease, and then they were able to correlate that the more severe the periodontal disease, and the greater the presence of the bacteria in the brain resulted in a higher threshold and a more advanced stage of dementia.
And then did they find the same thing without people? I mean, in people without that disease?
That they did not mention in the study, so I would have to look up and find out. But like I mentioned, that was not the target of their study. So when they do the studies and the tests and research, they focus on one area to try to find the correlation, and then of course they do have a control group yes. So the question is, yes, they did look at patients that didn't have as high a load and patients that didn't have periodontal disease, and yeah, they did find that that the P. gingivalis is a cause of it, and that the patients that didn't have dementia and didn't have periodontal disease were not as susceptible to dementia. So it's so it's not that it's like the exact 100% only cause, but there are other causes. It's one of the contributing factors. Okay. In regards to pulmonary disease, the previous study, these show that patients they always thought that it was usually patients that are older or more or debilitated or with severe respiratory diseases that are hospitalized because they're intubated and they have a tube down to help them breathe. That's when they get respiratory diseases and the migration of oral bacteria into the lungs. But recent studies have found that 50% of adults, when we sleep, we actually aspirate and breathe in these oral bacteria into the lower respiratory tract. That means deeper into our lungs. And this increases the risk of pneumonia, COPD, and other respiratory illnesses, and can also, exacerbate asthma and stuff like that. Did you want to do this? Okay, so Rachel's going to take over, and yeah, okay. You just roll, just click, yeah.
Sorry, I'll just stand here. All right, so I'm going to talk about put it down, okay, there. Pregnancy and oral health, okay. Okay, so poor oral health has been found to increase the chances of preeclampsia, spontaneous abortions, premature birth, low birth rate, and stillbirth. What they found in these research studies were the oral bacteria in the mother's mouth due to caries, due to periodontal disease, was found in the stillborn. And I even still remember I was either a sophomore in dental school when I heard that, and they let us out for lunch, and I was like, wow, that's crazy. How come this isn't in the news? So yeah, keeping your mouth clean, here's a reason why. Okay, and as we all know, morning sickness, that happens to a lot of women, and when they vomit, the gastric secretions can cause erosion. Because think about it, your very, very low pH acid in your stomach coming up, where does it come up? In your mouth. You spit, go along with your merry day. Hopefully you rinse. What you don't want to do is brush right away, because that's just like pouring acid maybe on your car or on something else and then brushing. What happens? It corrodes, erosion on the teeth. So what they recommend is a cup of water, and I think did I write it here? Maybe like a tablespoon of baking soda, mix it, make a solution, and then rinse. And then wait at least 30 minutes before you want to brush. Okay. Moving on, inflammation of gingiva caused by changes in estrogen and progesterone level. So whoever's been pregnant, or if you know a pregnant woman, you know that they can be hormonal. They're happy, they're sad, they're crying, they're laughing. Hormones change during pregnancy, and they not only affect our feelings, but also, as we can see, estrogen and progesterone levels. And that can happen around month 2 to 8 of pregnancy. Those levels, the changes in those levels can cause capillary dilation that results in gingival inflammation and hypertrophy. So when we say gingival, we're talking about your gums. And inflammation, that's when a bunch of cells come to the site and try to help the situation, but in doing so, your gums get inflamed. So they'll look red, they'll look puffy, and they won't look healthy. Okay, let's see. Changes in gingival state also change the oral biofilm / flora, and this process has systemic effects found to trigger a distant process that is similar to bacterial vaginitis, myometrial contractions, and preterm birth. So these changes are what was causing the preterm birth in these babies. I think there's a picture, an example of pyogenic granulomas / pregnancy tumors. So what can happen is the gingivitis that we're talking about during pregnancy with the hormone changes. If food gets trapped in between your teeth or under the gums, it can cause a very severe reaction of inflammation, and this is a pregnancy tumor that you can see in pregnant women. 50% of pregnant women do end up having pregnancy gingivitis, but if you take care of your teeth, do the flossing, brushing, then this is less likely to happen. But if it does, don't worry. It's not a real tumor, it's benign, and once you give birth and start on your oral hygiene regimen, it'll slowly go away. So that's good. And then increased chance for caries due to reduced oral health and increased snacking and eating. So as I've said before, during pregnancy, hormones up and down. You feel like you want to eat, you don't want to eat. Chances are in the first trimester, you get sick. But then after that, you make up for what you didn't do in the first trimester, and you're snacking, maybe in the night, maybe in the morning, maybe all day. And that continual snacking of the food in your mouth can lead to more dental cavities. Okay, and then I will come back for the kids section.
And yes.
The gastric secretion reflux.
Uh-huh.
Do you have any suggestions for eliminating that?
Unfortunately, I guess you would have to refer to an MD for the morning sickness, but for pregnancy, morning sickness just unfortunate side effect, and not being a woman myself, I wouldn't know how to. Yeah, it's for morning sickness, and gastric reflux, and that's a good point that you bring up. If you do have gastric reflux and, yourself, and not due to morning sickness, if you have, GERD and things like that, it does affect, your teeth. If it happens a lot and it gets into your mouth and you're leaving it in there, it does lower it makes your mouth more acidic, and then it causes the teeth to decay, or demineralize and weaken and then decay. So for that, usually I would see your MD and see if they have some stomach medicine that can help you manage it, And like Rachel mentioned, you can always, after you have that, rinse with something a little basic, put a little baking soda and water and just rinse with it, and then so that it kind of eliminates and balances out the acidic environment in your mouth. Mm-hmm.
Have some friends up in Trinity.
Mm-hmm.
This lady suggested charcoal pill.
Mm-hmm.
So I was taking one charcoal pill in the morning
Mm-hmm.
for a few weeks,
Mm-hmm.
and it seems to eliminate.
Okay, that's great. Yeah, if charcoal works, then that's wonderful. I myself have not used it, and I could look it up and get back to you on it. But for me myself, I know Rachel has tried to give me charcoal sometimes when I have an upset stomach, and it doesn't work for me. So I think it's just case by case, and for each person it's different, like what works for them. But if charcoal works for you, that's great. Yeah. Mm-hmm.
But I had to take it for a while.
Mm-hmm. Yeah. Yeah, it's with all medications too. Mm-hmm. Okay. Yeah. And then I also wanted to point out that when Rachel went over the changes in gingival state, and it causes this inflammatory process and it has systemic effects, they found that with periodontal disease, it causes the body to release different hormones and proteins that can actually cause early contractions and preterm birth. So that's why that's why we put up preterm birth there. I mentioned preterm birth is because sometimes the periodontal disease that a pregnant woman is experiencing can actually cause the body to release hormones and things like that cause early contractions and preterm birth. Mm-hmm. And also, to touch back on that point of the pregnancy tumors and inflammation of the gums, it's a hormonal thing. So if if there's your children or your sister, relative, friend is pregnant and they're going through this and they're just frustrated because no matter how well their oral hygiene is, it's not getting any better. It just keeps the gums are there. Just encourage them, give them encouragement, tell them to see the dentist. And it's not on their own fault that they're not brushing well. It's just that the hormones and everything is causing the gums to swell, and like you see on an example is that big huge tumor and scary looking thing that, oh, what's going on? Do I have cancer? Do I have something? It's just a normal part of the hormones, and even if you were to excise it and take it out during pregnancy, it usually just grows right back. So it's after they deliver and the hormones and the body resets to a homeostatic state, and then everything resolves. So it's important to encourage, family, friends, anyone that is pregnant that's experiencing this, to not lose heart, just maintain your good hygiene, and go see their dentist and see if there needs to be some professional help with cleaning and maintaining that health, but don't give up because it's hormonal and not because of their own fault. Okay. Is that really washed out? Okay. So we're moving into the next portion, and I wanted to make sure that we all are, I don't know how familiar everyone is with anatomy of the tooth, but is there any way to darken that? Because is it really faded? Yeah. think it's just, maybe it's too bright. Yeah. Yeah, but it's okay, I'll continue. So as we all know, the outer portion of the tooth that we see, that's the white part, is called enamel, and underneath in the inside of it is called dentin, and then in the very middle is our pulpal tissues and the nerves and blood vessels that supply nutrients to the tooth. It's a little hard to see, but let me see. Okay, yeah. So right along here, why I picked this picture and I really liked it is because most pictures, they don't put this part. And what it is that there's a very thin, microscopically, there's these little ligaments that attach your tooth to the bone, and they act as like a shock absorber in your car. So when you bite, it kind of absorbs the shock and everything and protects the tooth and the bone. So usually when we see periodontal disease, right in between the gum right here and the tooth is a little pocket. And if you've ever heard your dentist, counting off these numbers and just being very evil and poking you in the gums and saying, you're causing you to go, ow, 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 and all you hear is 2, 2, 3, 4, 5, 3, 3. If you hear 2s and 3s, you're great. If you hear anything more, if it's 4 and 5, 4s, it's okay. 5 means that you might have a little bit more progressive periodontal disease. And that's what we're measuring for. So we do apologize. We don't want to do that. That's not our favorite thing to do either, but it does help us measure a little bit better. It's not the most diagnostic, but it does kind of give us an idea of how severe the periodontal disease is. And unfortunately, usually we can see it in x-rays, but for insurance purposes and stuff like that, and for medical documentation, we have to chart and make sure that, those pockets are actually there. So that's what we're doing, and we're just measuring these little pockets right here. Okay, and the reason I picked this picture is, and I'm sorry it's really washed out, but under the enamel there's a dentin, and then right here where the bone connects to the root, I guess it joins to the root and the periodontal ligaments, is what we call cementum. And now the enamel itself, which I will mention later on, it demineralizes when our mouths reaches the pH of 5.5. So it's back to high school and college chemistry. If when it reaches a certain acidity level, that's when the tooth structure breaks down. For enamel, it's pH of 5.5, so it's pretty low. But for dentin and cementum, the two softer structures, it's actually a pH of 6.7. So it doesn't take much, because right in the middle, for most basic is 14, the most acidic is 1, and right in the middle is 7. So if you think 6.7, that's just a little bit off of the midline, and it's already going to cause erosion of your cementum, the roots, and the dentin. So that's why patients with periodontal disease, they're usually a little bit more susceptible to having cavities on the root surfaces, and then they get a lot more sensitivity and pain as well. And then unfortunately for older patients and older individuals, because as we get older, our salivary production gets lower, and if we don't have our saliva, it doesn't flush out and clean out our mouths as well, then it's even easier for bacteria and things to cause cavities along the roots and teeth surfaces. Okay, so now I'm getting into the more detailed explanation of dental caries as a disease. And I kind of got over a little bit already, but caries is caused by bacteria eating the carbohydrates and sugars that we eat and then as a byproduct, releasing acids. So that's why, your dentist always, don't eat candy, but it's not just candy and sugary sweets that cause the cavities, it's also carbohydrates, because that's what the bacteria likes to eat. Carbohydrates, they breaks down into sugars. So the more broken down the carbohydrates are, the more simple the carbohydrates are, the easier it is for the bacteria in our mouths that metabolize these things to eat and release acid. In terms of the types of bacteria, the little diagram on the right over here, that's a list of all the different types of bacteria that's in our mouths. Yeah. So some of them, and it's all charted to, how acidic, and it's a little hard to see, but I just wanted to show, that that's how much bacteria is in our mouth. And the thing is, it's scary, but it's not at the same time, because some of the bacteria is actually good. There's good and bad bacteria. And that's why, if your dentist tells you eat more proteins, eat more fats like cheeses and stuff like that, is because the good bacteria does metabolize that, and their products are more basic, and it raises the pH of our mouths. But the main cavity-causing or caries-causing bacteria is Streptococcus mutans. And what Streptococcus mutans does is it creates a cellular matrix. So that white plaque that we scratch off, that's this guy. And what that does is, what he does is he's like the real estate and contractor. He creates this huge community, and he invites all the other bacteria that's over there to jump into that, to live in that white plaque that he builds. And then that bacteria then eats all the sugars and carbs that we eat and releases acids as a byproduct. And the acid they release is lactic acid, and it's a little concerning if it's prolonged. So if you're eating, a lot of sugars and over a long period of time, or you're eating very sticky foods, then it's a concern. But if you're just eating it and you're swallowing it right away, and it's just a little bit, your saliva, your body fights it off, and that's why we say it's important to brush your teeth and get rid of that plaque. Yes?
The tooth doesn't like acidic environment, right? So if you're eating pineapple, it's acidic.
Yes.
Should you eat almond milk right along with it to counteract the acidity of the pineapple?
No, actually it's okay, because it's not like, if you were to eat something acidic or you eat something sweet, that this process happens right away and you're just dumping acid onto your teeth. It takes a long time, and that's why dental caries is a chronic disease, because it takes a long time for this to build up. And now, I don't want to say this to enable you to not brush your teeth, and say, if I have this time to do it. Usually it takes about, I believe the last study I read, and this is from dental school, and what they taught us is about 48 hours when a cavity starts forming. So that means if you're exposing it to a low acidic environment, your mouth is acidic for about 48 hours, that's when a dental cavity starts forming. And then once the cavity forms, like if it's a very small lesion, you can actually have the body recover it by bringing the pH back up. So not to say you can not brush your teeth every 2 days, okay? Only brush your teeth every 2 days, okay? You brush it every day but it's not a concern. You don't have to worry about, I cannot eat this. I love pineapple, because I love pineapple too. But you can eat it. You can eat all the fruits and everything, and that's why I mentioned last week when I made the announcement, you can eat chocolate too. It's not a big issue as long as you're brushing and keeping things clean, and you're not leaving the sugars there for a long time. And just to be a little more facetious, this is just a little more picture diagram of how the caries process works. So the S. mutans creates a plaque matrix on the teeth. So it's like they build a house, they build a bunch of tract homes, and then the other bacteria move in. And then when you eat carbohydrates and sugars, it's like cloudy with a chance of meatballs. It's raining ice cream, it's raining chocolate, it's raining spaghetti, all these things that the bacteria loves to eat. And then the bacteria eats the sugar, and that happens. And I put the poop there because it is actually bacteria pooping on your teeth. And I say that because I just want to make it as graphic as possible so that you realize that, it's not just acid, they're, pooping acid, and that acid, that lactic acid is what causes the tooth to demineralize, and you get that over a long period of time. Okay. Now, in terms of periodontal disease, it's caused by the bacteria and the plaque building up along the gums, so when you and causing the gingiva to become inflamed, and then when it becomes inflamed, it pulls away from the teeth because of the inflammation, and then it forms a bigger pocket, and then the bacteria gets in deeper, and then your body tries to send in, has an immune response and starts to send things in there to fight it, and the inflammation gets more severe, and it causes the gingiva to pull away more. The bacteria gets in deeper, and it causes the bone to, recede more. And as you can see, this is a mild case because right here you can see is where the enamel is, and then this darker yellower area is the cementum that I was mentioning. So the gums are supposed to be up here. So this is not too severe of a case as opposed to this person's, where they really let the periodontal disease run rampant. And unfortunately, there's a lot of bone loss. And on this X-ray, you can see, like right here, there's completely no bone left around that tooth anymore. Mm-hmm. Yes.
Is there a genetic component to periodontal diseases? Some are, some are not.
Yes, there is a genetic component. Each person's mouth at rest is different in the sense of how acidic it is. And then it's also been found that for Asians and Mexican Americans and Hispanics, we're more prone to having periodontal disease as opposed to Caucasians and African American and Black people with genetic-wise. They're more predisposed to caries. Some ethnicities and races are more predisposed to periodontal disease. It's all in the genetics. But that doesn't mean that because of the genetics, there's no hope. If you have good hygiene and you maintain it well, it's still okay. It's just that it's easier for certain people of certain races and ethnicities to be more easy for them to have it, but that doesn't mean that good hygiene and good oral health care can't prevent it. And in terms of periodontal disease, and unfortunately, once it gets to even, once it becomes present, there's no way to grow the bone back or the gums back. There are some newer procedures out there that helps kind of raise the gum level and everything, and you get some of that back, but there's no way to ever get 100% of it back. Even with the modern day surgeries of bone grafting and, different things, there's no way to grow back the bone, especially in cases like this where it's so severe that the bone is completely gone. Mm-hmm. So now that we gave you all these scary things, we wanted to make sure that you left with, things on how to ensure a healthy smile and to make sure that you do have your teeth and you can take steps in making your mouth a little healthier. Because unfortunately for most dentists out there, and even myself where I'm currently working, and I work at a local clinic, for low-income families and stuff like that, we simply don't have the means to address anything but the symptoms. And for most dentists, we target the symptoms of the problem and not the actual problem. And by symptoms, I mean we're treating the cavities, we're treating the periodontal disease, but we're not treating the source and the cause of it. And we're doing the fillings, we're doing the cleanings, we're doing the crowns and the root canals, but unless we address and help our patients and help each of you and our friends and family target the cause of it, it's just like you're on a sinking ship and you're just throwing buckets of water out of it, but you're not plugging the hole. If you plug the hole, then you don't have, and once you clean all that water, then you're okay. And so the main part of this lecture and why we share all those things for you is because we want to make sure that we also share this with you too. And like I mentioned before, unlike our bodies, anywhere else in the body, if you have a problem, it hurts and there's a problem, or it's sore, it's achy, it's not functioning well, you move your arm and it hurts here, you might have a shoulder problem or a muscle problem or something like that. But for teeth, unfortunately, by the time it gets to be painful or the tooth is very mobile, the bone is lost or the cavity's already gone very deep into the tooth. And sometimes it needs a root canal or, you need a big filling on it. So prevention is, key, and because, you only see your dentist, I don't know how many times a year, if that, because I know we're scary and we like to poke you with the little sharp things and call out weird numbers, but you see yourself every day in the mirror at least twice, in the morning and when you go to sleep. And if you have really good hygiene, then you maybe brush 3 times a day, and you see yourself 3 times a day in the mirror, So it's all up to you to take care of your home hygiene, your teeth, and take care of the brushing and the diet and everything like that. And that's what we want to help and enable you to do and share with you what we know, because unfortunately, for a lot of dentists out there, even though we know this, they don't have the time to share it, or they don't share it. Oh, sorry. Okay. So there's 2 aspects of how we can help with home hygiene and home care. And the first one is the diet, and that targets the bacteria's ability to eat the food that they like to eat and release acid. And like I mentioned before, you can also give them a different type of food so that the good bacteria is eating and producing a more basic thing, so that your mouth is not as acidic. And then, as with Godzilla here, if you're brushing your teeth and destroying the plaque, then there's no house or no place for the bacteria to reside in. So those are 2 areas where we can target at home to help ensure a healthy smile and healthy teeth and improve oral health. Okay, so for a dental healthy diet, our saliva contains the protein sialin, and at the very tail end of sialin is arginine. And arginine is actually the protein that the good bacteria likes to eat. And when the good bacteria consumes the arginine, it releases the ammonia and urea. And this raises the pH of the mouth. So eating more foods that are high in arginine, or brushing with the arginine toothpaste, can help. Foods that contain arginine are things like spinach, seeds, nuts, and legumes. And there's a whole even longer list on Google if you search it. And also you can eat more proteins and fats like cheeses, nuts. I know some of us are vegetarian, so tofu is good for protein. Or if you are a carnivore like me, then fish and other proteins and meats is also a good alternative to eating sugars and carbohydrates. But this is not to say it's not okay to eat sweets. It is okay to eat sweets. You can have your cake and eat it too. Okay, you just want to make sure that you're not giving bacteria, exposing the bacteria in your mouth to prolonged sugars and carbohydrates. So just don't make sure you're not snacking on a bag of Skittles or M&Ms over the course of a day. Every 5 minutes you put one in. Just eat the whole bag, eat it with lunch, and you should be totally fine. Okay. And fruits are also okay. Fruits are high in sugar, they're higher in fructose, and bacteria do use that to form acids, but they're okay to eat. Okay, just make sure you don't eat dried fruit, because the dried fruit is a lot more sticky and it's easier to get stuck on the teeth and stuck between the teeth, and that's when it exposes the bacteria allows the bacteria to process that and create more acids long term. Another alternative to the diet for sugars is the sugar xylitol. And what xylitol does is that the bacteria, Streptococcus mutans, it loves xylitol, and when it tries it, but the thing is, when it takes in the xylitol to try to metabolize it, it cannot. It can't use it to form energy, but it keeps trying to eat it, and it keeps trying to eat it, and it releases it. So I can't eat this, spits it back out, and it tries to eat it again, and then it just expends all this energy to the point where it cannot form the plaque matrix anymore. So with prolonged exposure to xylitol, the bacteria can no longer form plaque or sticky plaque. Okay. In our modern day diet, and especially in the United States, corn and high fructose corn syrup as a substitute that we've noticed has been very prevalent in a lot of the foods we eat and in some of the things we buy from the market. Most things now before where it used to use cane sugar and and sugars, it now uses high fructose corn syrup because it's a lot more affordable for them to do this. And companies, I hope I don't get in trouble for this from them, but like companies like Coca-Cola, they actually make their own high fructose corn syrup, and they make it sweeter than the normal one, high fructose corn syrup that you can buy, and they put it into their sodas. So if you've ever gone to like Mexico, you go to another country where they sell Coca-Cola and it has sugar in it, and you drink it, it's actually a lot less sweet than what we as Americans are used to. But because they've been using the high fructose corn syrup and it's so sweet, we've gotten used to the taste of it. So when we don't get the taste, we want it more, and it's very addictive. And what the bad thing about high fructose corn syrup is that it's mainly dextrose, and our body loves dextrose. And if we have a high concentration of dextrose in our bloodstream, our saliva actually starts releasing dextrose with the saliva. So we're bathing. So the more dextrose and high fructose corn syrup we produce and what we consume, our saliva glands actually release sugar, dextrose, along with the saliva into the mouth, and it's like feeding the bacteria 24/7 every time we produce saliva. And of course, if you can forgo sweets and things that's great, because when your body reaches the homeostatic level where where it doesn't have a lot of sugars in its blood, your body actually releases hormones that causes your teeth to sweat. And what I mean sweat is that they had a study, I believe in the 60s, where they took a rat and they knocked it out, and then they gave this hormone to the rat, and they put a microscope on the rat's tooth, and they actually saw liquid coming out, being exuded from the rat's tooth. So it's amazing because God gave us this mechanism for the tooth to push fluids out and expel waste from the tooth. But the thing is, because of our diet and all the sugars that we eat and our addiction to sugar as a culture, it inhibits our body and our teeth from doing this. And also in the 30s, and there was a Dr. Price who was a dentist, and he traveled around the world examining indigenous peoples and peoples that were and then he noticed there's one thing in common with a lot of them, and that's that they had really healthy teeth, really healthy bone, and none of them had, unerupted wisdom teeth. They didn't have crowding. They had really strong teeth and strong bones. And, these are cultures that don't have toothbrushes, don't have access to modern medicine, don't have access to modern dental knowledge, but their teeth are very healthy. And he found that the link to this was that they had diets that were very high in fat-soluble vitamins, in particular vitamins A, D, and K2. And these three vitamins together, they help transport the calcium and the minerals that we eat to the correct places. So without K2, and for a long time he couldn't identify vitamin K2. He just called it the mystery vitamin, or mystery fat-soluble vitamin, because he couldn't identify it and isolate it for the longest time until it was just recently where they finally identified it as vitamin K2. Because without vitamin K2, that's actually the vitamin that helps your body transport and allocate those proteins, and the vitamin A, the vitamin D, and the calcium and things that we eat. It actually helps the body allocate it and direct it to the correct places. And with vitamin K2, A, and D together, then the calcium that we eat, the things that we eat gets transferred to the teeth and the bone, deposited in the bone and the teeth to help not only bone development for kids, but also helps us to have stronger teeth and healthier bone.
What are some of the foods that have vitamin K2?
There's a lot, it's mostly fermented foods, so things like kimchi, and I'd have to look it up because like all the foods that I looked up, most of them were things that we as Adventists cannot eat except for kimchi. Pickles, sauerkraut, kimchi, and some other things like usually fermented things that contain K2. But they do have K2 supplements that you can purchase on Amazon and things like that. But if you are going to give it to younger kids to help them grow healthy jaws and teeth and everything like that, I would say consult your pediatrician first. Okay. Unfortunately, I don't know. Yeah, it's like I myself, we've tried taking it and then we tried looking it up because we were doing the research, and there's unfortunately not a lot of research on it. It's just a couple papers and very isolated. And it's becoming more prevalent now. There's a couple more dentists talking about it and having more podcasts and stuff like that. And that's actually how we heard about it. But in terms of actual dosages, not really. I would say consult. I can look it up for you and try to find some. So I know like the recommended dosages for an adult, but you can always consult your MD to your family doctor to see if they have any recommendations or if they know anything. Mm-hmm.
Question.
Yes.
What did you say about corn just now? I kind of missed it.
Oh, so corn they found is that it's linked to high incidence of not only caries but diabetes and other systemic diseases, because they did a study where they went back to Europe and they dug up all these older cultures after a battlefield. They would dig it up and they would look at the skulls and the bones and in particular the teeth and the remains of these people that died and passed away in these ancient cultures. And they found that before Columbus brought corn back to Europe, there was a lot of incidents of periodontal disease, but not a lot of incidents of cavities and caries. But after he brought corn back, then the incidence of caries, they found a lot more tooth decay, and they found the prevalence of tooth decay. That's when it started occurring. And actually, there's a city called Cahokia, I believe, where they have a whole. It's in America. It's I think in the Midwest or in the South. It's called Cahokia, where they have an Indian, I believe it's a Native American village that culture and all the people of the village disappeared and they don't know what happened to them. But when you go there, there's a sign that says, because of corn, the people of this area, suffered a lot of systemic diseases and they died off because of systemic diseases and caries and stuff like that. So corn is actually quite detrimental to our health. Although in limited amounts it's not bad, but when it comes in the form of high fructose corn syrup, it's bad because it's dextrose. Yeah. Did that? Okay. So I'm going to turn the presentation back over to Dr. Rachel, and she's going to go over the hygiene.
Okay. Dental hygiene. So first of all, pick the right toothbrush. When you go to Rite Aid or Target, there are a whole bunch of toothbrushes, toothpaste. Where do I start? Pick a brush that has a soft bristle. You aren't trying to clean out a toilet. You are cleaning your teeth. So nice soft bristle, because you also want to brush your gums. And if you have a hard bristled toothbrush, you're going to tear away at them. We love using the Nimbus brush. We were going to bring toothbrushes, but our shipment hasn't come yet. But maybe next time if we are here. Okay, for your brushes, replace them when the bristles are bent. That's usually about every 3 months. Okay, your dentist will help you pick out the right tools for your unique mouth. And the reason I say that is patient A and patient B may not be having the same set of teeth. Maybe one person has a gap between their teeth, one person is missing a tooth. So for A and B to clean with the same instrument, that isn't going to be conducive for both of them. So when you go to your dentist, they will give you specific tools that will help you to clean. There's things called floss, super floss. There are all these different tools to help you. Okay, and when you brush, don't rush it. Brush gently for at least 2 minutes twice a day. And I know that seems like a lot to some people, but ways to help, you can turn on a song for 2 minutes, brush to that, or get a timer. And some of the electronic toothbrushes, they actually have 2 minutes dialed down on that, so you know, and it'll beep every quadrant. So 30 seconds, 30 seconds, 30 seconds, 30 seconds. Okay, be thorough, clean all the surface of your teeth. The outer surface, when I smile, those are the teeth you can see. The inner, the ones you can't see, and your chewing surfaces, which would be where food is going to go. So you want to brush all the surfaces. And you can see that there is a surface missing, the ones where teeth and teeth touch, and that's where floss comes in. And then we'll talk about floss later. Let's see. And be gentle, again, as I said. And don't forget your tongue. A tongue scraper is really good to use. It'll take away any debris, because if you actually look at your tongue closely, it's little filaments sticking up. Pretend it's like carpet. And all the little debris that get stuck in fluffy carpet, not carpet like this, you would be able to take out the debris by vacuuming. So that's the scraper. Okay, so there's a method called the static brushing technique. You want to start at your upper right molars, and molars are the teeth in the very back, and move across the front, then work your way to the backs of the teeth. And you want to do that for the lowers as well. So basically, if you've seen cartoons, they go to the sink, they grab the toothbrush, and they go, and you hear that sound. You don't want to be going back and forth. You actually want to stay at the tooth, tilt your toothbrush maybe at a 45-degree angle so you can kind of get into the gums, and just small circles. Pretend like you're painting each tooth with the toothpaste. So you're getting every little spot. Because if you think about it, when you go like this, you're missing the indentations. And then in the inside of your mouth, if you're just going like this, you're missing a big part because you have a curvature here. So when you go into the tongue area, you want to turn your toothbrush vertical so you can get these teeth here and on the top as well. Okay. Ooh, I don't have the mouse. You have the mouse. Okay. Okay, flossing. You can get around an 18 inches of floss, wrap them between your two fingers, middle fingers, and then use your pointers and your thumbs to hold the floss. And what you want to do is form a C-shaped hug around your tooth. And you want to go up and down in a slow manner on each side of the tooth. And then when you go in between the teeth, don't be forceful, just gently go, because you don't want to snap and hurt your gums. And for flossing, if that's too hard for some people or they want an easier way, there are flossers, and then there's also a water pick. And if you do use a water pick, make sure to turn it to at least 70, 80, 90% of the power, or else it's just like you're swishing yourself. But with the water pick, what it does is it swishes water in between your teeth like a high hose, getting all the getting the plaque off. So when you brush, the reason why we brush is we want to displace the plaque. The plaque on our teeth is, as Dr. Alvin said, where the other bacteria can keep building on. So once you displace the plaque, it can't stick on your teeth anymore. It'll have to build new plaque, which you'll have after your next meal of carbohydrates. Okay. And an example that I gave kids at summer camp once was I painted peanut butter. We were down in Honduras, and they love peanut butter, and we were doing oral hygiene. I painted their hands with peanut butter, clean hand, so they could lick it afterwards. And then the other kid had a toothbrush, and I said, okay, brush all the peanut butter off. So they brushed, pretend like these are your teeth, the fingers. They brushed all the peanut butter off. And I said, okay, this is what happens to people who brush but don't floss. And I said, okay, open your hands. And the little kid opened their hands, and there was all this peanut butter, and all the kids said, ew. And that's exactly what happens when you don't floss. Everything that you ate is going to be stuck there, and maybe you'll see it a couple days later if you swish really well. So flossing, very important. Okay. Special considerations for expecting mothers. So this goes with the pregnancy conversation. A lot of pregnant people, or even my OB called me maybe a month ago and said, I want to send my patient to a dentist, but they won't accept my patient because my patient's pregnant. Can they come to you? And at that time, our practice wasn't open yet. So I was like, sorry, not now, maybe in 2 months. A lot of people are scared to get dental work during pregnancy because who knows what can happen to the fetus. During the first trimester, that's where all the forming of the fetus, the majority of the forming happens, and it's a very delicate time. So when things go wrong, people want to point fingers, and it's easy to point at dental work or at x-rays. But in actuality, the American Dental Association recommends that pregnant women get cleaning throughout their pregnancy. In fact, some insurances cover up to 4 times a year for pregnant women, which is more than the regular population, 2 times. So getting dental work done while you're pregnant, dental work is different than cleanings. Cleanings throughout pregnancy is fine. Dental work, the American Dental Association says it is safe, but they recommend doing it during the 2nd trimester. Why? First trimester, women probably don't even know they're pregnant. They probably won't show until later, so you don't really know. And then 3rd trimester, you're just so big, you're uncomfortable. You don't want to be in a supine position for that long. If you do need dental work, they say it's okay. You just want to make sure to lay on your left side, so they wedge a pillow under your right side. And that allows the vena cava to give blood and oxygen, the oxygen flow, to the baby. So for any pregnant women or people who you know, tell them, get their cleanings. Don't be afraid to get your cleanings. Dental treatment, keep it within the 2nd trimester. If there are emergencies, it's better to just take care of it then, because the more stress you put on the fetus and the mom, it can lead to early birth. Okay, yeah. Okay, a lot of people wonder, is anesthetics, are they safe during pregnancy? And local anesthetics are safe during pregnancy. As I said, the more stressed and in pain the mother is, the greater the negative effect on the baby. So it's better to feel numb, get the work done, than to be in pain for that whole time because you're causing stress on the baby. And antibiotics as well, amoxicillin, penicillin, are safe according to the American Dental Association. You want to avoid tetracycline during pregnancy because what it does is to the baby growing, that's the time where tetracycline will stain the baby's teeth. So it's like someone took 4 different colors of brown and just went to town on your teeth. So you'll see different lines of brown. And that's what happens if the mom takes tetracycline while pregnant. And that's Naomi. So I'm going to talk about babies and kids. You've probably seen her around collecting the education dollars. Okay. All right. Newborns and infants. Okay. When babies are born, after the mom feeds the baby, what we recommend is get a soft, damp cloth and rub the gums of the baby. They don't have teeth. Why are we doing that? It's to get them accustomed to the feeling. Oh, I eat and then someone cleans my mouth. Okay, I guess this is normal. And you're also, cleaning their mouth. Once a tooth erupts, yes, brush with a soft, bristled toothbrush, again, soft, with a fluoridated toothpaste. I know there's a lot of controversy between fluoride, no fluoride, fluoride. Personally, for me and the American Dental Association, fluoride, we recommend fluoride because it strengthens teeth. And we give guidelines. For example, 0 to 3 months, it's a size of a grain of rice. So you're not squeezing it all in, it's just a little. And then kids 3 to 6, it's the size of a pea of toothpaste on there. And then you always want to supervise the children to help them spit. Let's see. And then we talked about ADK2. And once the teeth are touching, you want to start flossing their teeth. Because as early as 1, 2 years old, they can get a cavity. And have you ever thought about bringing a 2-year-old to the dentist to get cavities filled? It's not fun for mom or dad, especially for the kid or the dentist. Okay, avoid sending babies to bed with anything in a bottle except for water. Previously, people would give babies milk, send them to bed because it'll put the baby to sleep. But milk, as we know, have sugars. Sugars break down to carbohydrates break into sugar, sorry about that. And then it just feeds the bacteria while the babies are sleeping. And avoid sippy cups of juice, milk, sugary drinks. Water is best. And you want to schedule your baby's first dental appointment when they get their first tooth and not before their first birthday. That seems a little much to some people, but it's number one, getting the baby familiar with the dental office. And the dentist can check for any tongue ties that your baby may have. That's like if you lift up your tongue, you're able to do that. Some babies aren't because there's a fiber that attaches to the tongue. Sometimes it is too much and it's not the right size. So the baby's tongue can't lift, tongue ties. So there are different type of ties that dentists will check for. And that can cause speech delays. Okay. Toddlers, kids, as I said, 2 times a day for 2 minutes with pea-size size of fluoridated toothpaste. Floss daily, supervision. I have a toddler. She's very independent, so I let her brush her teeth, and she thinks she does a good job. When she's done, then I will go and brush after her. But for kids, bring them to the store, let them pick, their favorite color toothbrush, let them be involved in the process so they can take ownership of taking care of their teeth. And 20 baby teeth, that's what the general population is born with 20. Not born with, but you have 20 when they're all fully erupted as kids. I get this question, why is taking care of baby teeth so important if they're just going to fall out? Many parents. Here's the reason why. Baby teeth are space holders, so they are there for a purpose. If your baby teeth came out too soon than when they were supposed to, the adult teeth, they would come out crooked. Or there would be a traffic jam because everyone would want to come out at a spot that they shouldn't be coming out at. So if you've had family members where maybe, unfortunately, a kid had to lose their tooth, what they do is have a space holder, and they'll actually have this metal in their mouth to reserve the space. So example, tooth, and I'm a tooth, and unfortunately, I'm gone now. So these 2 teeth here, they are going to hold the space of the adult tooth, which is going to come up this way. So the tooth that I was there, I was holding the space, but now that I'm gone, these teeth on the side can drift, and the tooth on the bottom, the adult tooth, may have a hard time erupting. So with the space maintainer, it pushes the teeth to where they should be until the adult tooth comes up. And I mean, in general, you want to be able to take care of your baby's teeth because decay in children, that's not great either. And healthy habits, your child taking care, that's probably written wrong. You want to be able to take care of your child's teeth, children taking care of their own teeth, everyone taking care of their own teeth as children so that you can create healthy habits. So when you're adults, you will continue to have those habits. I think that's it. Yep. Yep.